Welcome to the weekly series of Caring Conversations, Empowering Lives for Cancer Care. In this series of events, we come together along with eminent experts in the field to discuss and empower cancer patients as they fight their battle against the disease. In today's event, we will first take note of a recent finding that emphasizes the need for uninterrupted treatment or starting the treatment early for increased survival chances for cancer patients. Then we will hear from our distinguished guest, Dr. Vijayalakshmi Deshmane, how breast cancer patients have a better chance at survival if the cancer is detected early. We would encourage you to ask questions to our experts by typing them in the comment section. We will get back to them at the end of the session. So let's begin with today's session of Beat Cancer Facts. Many a times there are treatment interruptions during an adjuvant radiotherapy. These are associated with worse overall survival in patients with triple negative breast cancer. This was a study that was published recently in the Journal of National Cancer Institute. The researchers found that as few as 2 interrupted treatment days had a significant effect on overall survival as compared to one or no uninterrupted days. For this study, researchers analyzed data from 35,845 patients from the US National Cancer Database who were treated for triple negative breast cancer, which is a cancer type where the patients are HER2 negative, PR, and ER negative, which are all tumor markers for breast cancer, and this determines how the treatment should be given for these patients. So these database contained patient data from 2010 to 2014, and the analysis was based on this. It was found that more treatment interruptions leading to longer treatment durations were associated with worse overall survival. Compared with the reference of 0 to 1 interrupted days, patients with 2 to 5 interrupted days had an increased risk of death, followed by 6 to 10 interrupted days and 11 to 15 interrupted days. It is sometimes important for the clinicians to interrupt the treatment to allow the patient's skin to heal from the damages that are induced by radiotherapy. This finding that as few as 2 interrupted days can significantly impact overall survival should encourage the clinicians to follow other measures so that the patient's chances are not hampered. They should introduce prophylactic measures to reduce the severity of radiation dermatitis and continue exploration of alternative therapies to minimize acute radiation related toxicities. Patients should also take note of such evidence based findings and discuss them with their clinicians to improve their chances of overall survival. In some previous studies, it was also found that interruptions in treatments, especially during the COVID-19 pandemic, had led to fewer patients completing the radiation treatment. And that had effect of increased locoregional disease progression. In another study, it was found that even a 4-week delay of cancer treatment is associated with increased mortality across surgical, systemic treatment, and radiotherapy indications for 7 types of cancers. It thus becomes imperative that for a patient's effective treatment and even to improve their survival outcomes, health policies should focus on minimizing system level delays to cancer treatment initiation. Patients need to be made aware of the importance of not only of early detection of their cancer, but also to start the treatment as soon as possible. On similar notes, today we have with us Dr. Vijayalakshmi Deshmane, with whom we will discuss how breast cancer, which is the leading cancer site for female worldwide, can be detected early. If treated in stage 1, patients have more than 95% 5-year overall survival rate. Let's hear more from Dr. Deshmane. Dr. Vijayalakshmi Deshmane is one of the leading surgical oncologists in India with over 3 decades of service as a surgical expert at the Kidwai Memorial Institute of Oncology, Bangalore. In 2015, she retired as the head of the department and director in charge of the surgical oncology department at Kidwai. She always promoted the practice of evidence based medicine and initiated a number of early evidence based practices that eventually became the standard of care in the department itself. She led multiple clinical trials for breast cancer patients. In her capacity as the president of the Karnataka Cancer Society, she endeavored to raise public awareness on breast cancer by organizing numerous programs. Following her retirement, she continues to involve herself in raising awareness on breast cancer and also serves as the president of Abala Ashram, a shelter for orphaned girls in Bengaluru. Welcome, Dr. Deshmane, to our event, and we hope to learn a lot from you today.
Thank you.
Namaste, Doctor.
Namaste.
So, I extend a hearty welcome to you. And
Thank you so
as we
much.
were discussing how the early treatments, early diagnosis of breast cancer patients can help them. So, let's begin the discussion by understanding who are at risk for getting breast cancer.
Namaste. Thank you for the kind invitation. Uh, Thank you for the kind introduction. Breast cancer is common and it is curable. Planned
Okay.
treatment completion is very important.
Mhm.
So I think for that reason you planned this meeting today.
Yes. Yes. So, doctor, we wanted to understand from you who are the people who are at the risk for getting breast cancer?
I will give the list of people who
Mm-hmm.
are at higher risk, or they are listed as high risk group. Number one
Okay.
is early menarche,
Mm-hmm.
that is menarche or the first period happening below 12 years. Late menopause, that is menopause occurring after 55 years.
Mm-hmm.
Nulliparity, there are no issues, where there are no issues. So that group, and full term delivery after 30 years, even they are at risk, high risk of cancer. And previous breast cancer, so disease may occur in the same breast or the opposite breast, that comes under a high risk again. And patients with family history of breast cancer in the first degree relatives, that is maybe mother or aunt, sister, anyone having suffered from the breast cancer, they come under high risk group. And earlier period, maybe this bombardment everywhere happening, like Ukraine war and all that, so radiation exposure for any reason or with the treatment also.
Okay. So, if I understand correctly, hereditary is, of course, a factor. And you said a patient who has some abnormal reproductive history in the sense that they have started the periods earlier or if they have menopause later. So, that can increase the risk of
Yes,
breast cancer.
yes,
Okay. And is it also possible that breast cancer can occur in men?
yes, it occurs in men, but it's a rare disease. Maybe we will concentrate on female disease today.
Okay. Sure. So, as I understood, hormone plays an important factor on whether a female can get breast cancer or not. So, what are the reasons for this hormone playing havoc on the body?
Can you repeat the?
Yeah, so I was saying, you mentioned that any irregularity in the hormonal balance of, for the patient can play a havoc in the body. So, what is the exact reason that this happens?
Maybe at the time perimenopausal period. So these hormonal changes do occur in the body.
Okay.
Maybe that is one thing. All uh, changes do occur in the body.
Mm-hmm.
Maybe susceptibility um, comes to the patient.
Okay. So there are other hormonal changes that happens in a female body also nowadays. We see that there is an increase in the case of PCOD, polycystic ovarian syndrome. Then women also take contraceptive pills. Uh, Overweight is a bigger issue nowadays. So these factors do also they play a role in female getting breast cancer.
Uh, Obese patients in the postmenopausal period, they're susceptible. Then other thing is like hormonal imbalance by any means. They are also susceptible.
Okay. So you mean to say that if a female is suffering from polycystic ovarian syndrome, PCOD, then they should take extra care and get detections at regular intervals?
Patient with the PCOD or the people with the PCOD, very slight risk.
Okay.
So maybe they can go with the regular follow-up with the gynecologist. So
Mm-hmm.
nothing to worry as such, I feel.
Okay. Okay. That's good to know and will be a relief for the large
Yes.
female population that is
Yes.
suffering from this. Uh, okay. And when we say that breast cancer should be detected early, what is meant by early detection?
Early detection, um, what happens is it's more important that we can prevent the deaths uh, by planning the treatment if we can detect the disease at early stage. That's what is very, very important for us. Since it is curable disease and breast is superficially placed in the body, very easy to detect. So if somebody is conscious about the body, and especially after the corona, now health consciousness has increased so much. People are conscious about health nowadays compared to the pre-corona period. So maybe they will come to us at early stage. That is more helpful for them, for everyone, even for the treating doctor also.
Okay. And what are the common methods of detection for the breast cancer? Maybe the person, the female, can perform it themselves, or how is it?
Breast self examination is uh, okay if they're in a rural place and all that. If if they are in cities, if experts are available, then they can go for the clinical breast examination. That is the gold standard for the breast cancer.
Okay. And how, when should they start this clinical breast examination? How, from how young they should start?
um, like in India as such, we are getting breast cancer in more younger patients compared to the Western world. To my knowledge, 10 years earlier than the Western world. maybe 35 years, we can start the breast examination, especially the high risk group where there is a strong family history.
Okay. And how frequently should this be done?
Treatment as such, frequency. Okay.
The detection, you mentioned clinical breast examination. So,
Yeah.
how frequently should this be done for the high risk people and even for others?
Uh, breast examination is a simple thing. Breast self examination they can do at home. Uh, Premenopausal woman after the periods, uh, after 2 3 days, or after the periods after 1 week, premenopausal people they can examine on their own, but examination should be done with the pump, not with the fingers. That is a wrong method of examination. If they examine with the fingers, then everything, they feel it as a firm thing, then they will have a lot of confusion. So they have to examine the breast with the pump. Then if they get something hard, mass or the lump, then they have to approach the physician for the clinical examination. Whereas postmenopausal women, she can fix a day in the calendar, so every month they can examine by themselves. um, Whereas other people, yearly they can come 45 to 54 years for the clinical examination.
Okay. People also suggest mammography. Is that more effective than clinical breast examination?
As a physician, I feel, and going to the after river thing, I referred many after river invitation. I referred many articles and all that. So there, everyone suggests that again, lot of importance is given to the physical examination. Whatever you get, if you have missed with the mammography, also can be detected if it is a small lump palpable by the physician examination. So clinical examination is a must, especially for the family history, patients with the family history, because whatever you say, they will not listen to you. They want 100% answer. Maybe if there is a hard lump for some reason, or benign breast disease, um, that lump, they want to know whether it is benign or the malignant. That way physician examination becomes very very important.
So there are also chances of false negatives during a mammography, right? So
Yes,
maybe a
yes.
physical examination becomes important.
We can add even the, along with the mammography, ultrasound, so that ultrasound gives a lot of information, whether it is solid, cystic, texture, you will know the texture, and tumor size. So nowadays, along with the mammography, many will go for the ultrasound examination. That
Okay.
is very important, which is non-invasive, uh, and we get a lot of information.
Okay, and just out of my curiosity, because we are talking about annual checkups using mammography or ultrasound, how cheap or how costly is it? How affordable is it for a regular person?
In the same context, maybe we can go for the ultrasound first, and mammography is very painful as such, very very painful. So ultrasound gives a lot of information, especially we can decide whether it is benign or malignant, uh, along with the fine needle aspiration cytology. Guided FNAC also can be done with the ultrasound. So if it is benign disease, things are very fine for us, for everyone. They will be very happy. And mammography is very painful. Maybe in a high risk patient, where we have to have the non-palpable disease, we can go for mammography. Ultrasound, we have to, club, I think. Um, that will give a lot of information, size of the tumor, all that, cystic disease, all those things are very clear with the ultrasound.
Okay. And you were saying
It
these,
is cheaper also. Ultrasound is compared to mammography cheaper. When I was in Kidwai, they were charging 500. Now 1,500 and all, I think.
okay.
Ultrasound within 500.
So I think that would still be cheaper than getting to know that the disease is detected at a late stage, and then the treatment options and chances of survival. So I think even if it is 1,500 rupees, people should go for it and get it done, just to eliminate the risk.
Yeah.
And what are the
Now with
chances
the
of?
now with the globalization, people are ready to spend. Earlier,
Yes.
it was not the scene. So 1,500 and all is not much nowadays.
Yes, I can completely understand, especially after the COVID-19 pandemic, people are taking more care about their health. So, this is something that can be afforded.
Yeah.
And what are the chances of survival if the breast cancer is detected early?
Oh, very beautiful. For the same reason, I think you have planned this meet. Thank you so much to your team and your company. uh, Very good, curable 99%. If I can get the disease, especially if this is confined to the duct, nothing like that. Stage 0 disease, stage 1, early breast cancer, they do very well.
So, in many cases, people are not aware of these terminologies, doctor. What do you mean by a stage 1 breast cancer patient or a metastatic breast cancer patient? If you could
Yeah.
just tell it in simple words for the people to
Stage
understand.
stage 1 is where, stage 0 is where disease is confined to the duct, milk duct. That is, disease starts there in the duct, then it
Okay.
comes to the enters the parenchyma, breast tissue. So that is stage 0. Very rarely we get a stage 0 disease in India. I had one paper on duct carcinoma. So maybe only if we subject for the histopathological examination, only then I'll be able to stage the that, in especially the nipple discharge patient, in the milk, wherever milk comes in that area. If I get serosanguinous discharge or blood discharge, that nipple discharge we say. So if we can do the small surgery, removing that duct, so if we can send all that specimen to the histopathological examination, maybe they will be giving us a diagnosis, pathological diagnosis, that carcinoma. So once, if a disease is confined only to the breast, is stage 1. If stage 2 is disease beyond the breast, or underlying the structures are involved, underlying structures of the breast are involved, then this is going to the armpit area, where axillary lymph nodes are involved. That is stage 2. So stage 1 and 2, um, like, treatable, operable disease. This is early stage disease.
Okay, that's good to know the difference between these various stages. So sometimes we hear that people have are more disposed to breast cancer if they have ovarian cancer. You also mentioned that at the beginning of your talk. So is it possible, or is it advised that if a patient already had ovarian cancer, they should do breast cancer screening more frequently?
They are they come under high risk, but I had a paper, breast and cervix. That is double malignancy. Maybe metastatic disease, or the concurrent, simultaneous diseases, simultaneous occurrence. So synchronous. or metastatic. But now each breast is staged separately. So things have changed so much. So better if they go for a screening as such, but there is a high risk, especially the patients with a family history of other cancers. Anyway, in not only ovary, breast, even other cancers also.
Okay. And especially in India, doctor, we see a lot of female who are malnourished, right?
Yeah.
Because of various factors. So, do you think even if the breast cancer is detected early for them, they will have a chance of survival, or there is something to do with nutrition and the effectiveness of treatment?
Maybe we have to take care of the nutrition, because they must be able to tolerate the treatment. As in the introduction, you have given that picture, a plant treatment to be completed. So for the to complete the plant treatment, they have to have a immunity, great immunity, so that they will be able to tolerate the plant treatment. Only then we can think about the advantage of survival. So nutrition, we have to take care. That usually it will not happen, but we have to take care of the nutrition.
Recently, we were in an event in one of the rural areas of India, and people were concerned that there is a trend in Western countries that when they do genetics screening and they see that there is a high risk of getting breast cancer, they get mastectomy done or reconstructive surgery done. So, is this something that you think helps the patient or not getting the disease?
No, I don't think so. 22nd, I've given a date to one patient. She has undergone, treatment at Canada. She's coming to the ashrama here where I live.
Mm-hmm.
So bilateral mastectomy has been done, because what happens. Limitation is that I will not be able to take out all the tissue. Some tissue remains in the breast. So this becomes prophylactic. I think it becomes too much, especially in our place in India.
And
So
we also heard another thing in that camp that if a person is breastfeeding, then they get lower chances of cancer. Is that true?
to some extent, but even lady with the 10 children also I have seen having this disease. So supposed to protect, but how much it maybe other factors will act there.
Okay. So, all in all, if I summarize, the best way to prevent it, or not prevent it, but getting the best possible treatment would be to detect it early at earlier stages, like you mentioned. Nothing better than that.
Yes, you are right.
Any other parting thoughts? I know we can go on discussing this for hours, but because we have a restricted time now to end the event, any parting thoughts from you, doctor, and anything that we should keep in mind specifically?
Maybe this ultrasound to be added, which that one thing I wanted to suggest. Then breast cancer occurring in a pregnant lady, especially the primary. So that to be discussed, because usually because of breast enlargement, and they will not have that experience, so it will be detected very late. Maybe that also to be. And breast cancer occurring in lactating woman, all those things.
So
uh,
detection in those cases become
yes,
difficult,
yes,
and they
yes,
should
very
take
difficult.
special care.
And when to operate, when not to operate, all those things. When to give the treatment, when not to give the treatment. These things are to be, I think, included in our discussion.
Sure. And I can already see that we will need another session with you to discuss it in length, and
I think so.
we'll be happy to host you again another day, and
Very
maybe
nice. Great opportunity for me as such. Otherwise, I would not have read, you know. You know that I do a lot of other social work. So
yes,
added to that, even in the social work, they give the importance of your expertization. They believe in reading and all that, which I like so much. So you made me to, reread. Thank you so much.
and thank you so much, doctor. We will soon have you again in one of our events, and we can discuss more. Thank you
Yeah.
so much for
Thank
educating our users.
thank you. Thank you to the team. Thank you.
Thank you.
Thank you.
With this, we come to this interesting discussion with Dr. Deshmane, whom I am sure I'd like to have once more, because there are so many unfinished questions that we want to ask her. But in our weekly series next week, we have Dr. Emily Banerjee, who will be telling us more about the role that genetic screening plays in assessing the risk for cancer. Even Dr. Deshmane emphasized that there are high risk factors because of predisposition and earlier family history. So, this is something that we'll be discussing next week. Thank you for attending this event. Wish you all a very good day. Thank you once more.